Okay. Well, thank you so much for this interview. Well, as I spoke with you before, we are living in a world where technology is breaking the limits of health. Now we're probably having people who's obsessed with some hard statistics and how many steps they take along the day. So how technology is shaping the way we are living, and we are probably being more aware of how our health is evolving every day.
Well, I think exactly as you said, patients are being able to be more involved in their own medical care and learn about their own conditions and help to not only get information but have a consciousness about taking care of themselves. So whether it's counting their steps every day, watching their heartbeat, the rate of their heartbeat or their heart rhythm, they have this opportunity to sort of be able to gain information every single day that helps guide their treatment and help their doctors to follow them long term. And then beyond that, we have a lot of evolution of interventions and technologies that can help patients who have complex problems. You want to talk about some of the...
No, it's a very interesting time, because I think for the last millennia, the patients come to the doctor and the doctor tells them what to do and they try to do it. Now the patients are getting involved early for themselves and for their families, and so they're taking more control of their lives. They're taking better care of themselves because they're understanding what we already know and then applying it day to day, not just when they go to the doctor once a year. And I think that's a huge increase in the health of the population. They're not just waiting for something bad to happen, they're being more proactive. And I think that's a big advance. And allowing technology to be part of that, whether it's wearing a watch to monitor your heart rate or your rhythm, or using the internet and other social media to communicate new advances amongst themselves. I got this new thing today, whatever it may be. The next thing you know, 5 million people understand it, and it goes like that. It's amazing how quickly information and technology disseminates. It's instantaneous, and that is a big challenge at times for the doctors too, because what may get into the social world, the social media world, maybe not always, it may not be perfect. And so how do we then rein that back in and get them to understand that what they learned on Twitter may not actually be perfect? So we have to figure that out.
That's a big issue about the tips that everyone can assume or take on YouTube. For example, in Mexico recently we have a problem with an influencer. I was speaking with Aaron about that she was a vegan who trying to integrate more people to this lifestyle, and then someone watched her eating fish in Bali. So her whole strategy crashed because she had to spoke about what the health problem she had, and the doctor asked her to eat protein and animal protein. So the whole thing crashed, but the people are still trying to get some faith probably or tips or whatever it means that is not going actually to the doctor. But the amount of tips and speculations about health on the internet is huge. So have you ever had any problem about a person who probably had some remedy or something that saw on the internet?
Yes.
Every patient's second opinion is Dr. Google. So we do sometimes have to reel back some misconceptions that may have been obtained from social media or from other things on the internet, or maybe just not completely understanding the complex science that can come behind rolling out a new technology. I think overall, though, if we can have more educated patients and educated consumers, as we already mentioned, have more ownership in their own care, it can actually we can turn it to be helpful to help them understand exactly what needs to be done so they can be a real partner in their medical care. But I'm sure you certainly have encountered some patients who had an idea of what they wanted, whether or not it was the best thing for them.
It is. It's a real challenge. I will admit I'm not the best at keeping up with social media. I hear a lot about it, but I don't tweet, and I don't. Is Facebooking a verb? I don't know. But I don't do any of those things. Instagram, but we do have some of our faculty that do, and I think it can be very powerful to have the healthcare professionals engaged in that, and because they're not going to do anything significantly irrational. They're going to always try to put it out there what is best practice or what is really the right thing to do for the patients. And so, following a social media savvy physician, I think is a reasonable thing to do, and I think a lot of people can learn a lot from that. And that might be nutrition, it could be exercise, it could be cholesterol management, who knows. But I think all those things are very valuable. I think your experience with an influencer, which is another term that is new to me, is interesting, but probably by no means unique. I think there are a lot of people out there, and I think the younger the population, the more influenced they can be. They certainly haven't gotten enough time under their belts to be cynical. So I think that someone with the best of intentions, I think, might be putting things out there that maybe aren't so perfect. And I think you just have to be aware of what the limits are. Hard to sometimes know.
Yes. And do you think that technology is helping you to receive more patients? Probably, as you mentioned, nutritionists or probably psychologists are giving now digital I don't know the word, sorry, but where they get with the patient
portal sort
yes.
of. Mm-hmm.
And do you think that probably is going to be real for one of you, probably in some way, or do you actually need to see the patient physically to make a diagnosis?
Well, I think some of the bigger healthcare systems in the United States have embraced technology to offer access to healthcare and to offer access to the healthcare systems through telemedicine. So New York Presbyterian would be such a healthcare institution that really has invested heavily in telemedicine. So within New York, patients who have a variety of maladies that would be, you would normally go to an emergency room, maybe you have a cut or a burn or you're something in your eye, who knows what it may be. Going to an emergency room is really not a great use of the system. Number one, it's time consuming. There's long lines, there's a lot of patients, there's waiting, there's expense. And on the other hand, if you take a look at what New York Presbyterian has done, we have telemedicine portals in pharmacies in the city. And so people can show up and can instantly be seen by a physician or a physician extender who can then look at the patient, talk with the patient, and the machine is set up that they can get vital signs. And essentially you're in a little electronic emergency room being evaluated. And that gives access instantly to people who may not have had it. So I think that's going to grow a lot. So those people and administrators who have sort of had forward thinking to invest in these technologies, I think it is going to grow access and grow the ability of patients to be involved in that.
How would you receive a patient who already has a register of data of their own health? Is it going to change the game of how a patient is going to be, like change probably the role than being passive to active, and probably they'll probably have more ways to decide which treatment or which way he's going to take their medicine or remedy or.
Well, I think telemedicine, as Dr. Girardi already outlined, is changing the game, because it's in all different parts of their care. So it's used in everything from an emergency or urgent care visit in a pharmacy. It's used in our in intensive care units. It helps us to enhance remote monitoring of patients, and that can be everything from a consultation to being able to see some of the further out satellite type hospitals and be able to keep a closer eye on those patients and enhance care. And it'll continue to evolve. But if your questions also help patients to better understand their treatments so that they can...
I mean, how if I am probably before I was hoping that my doctor take the best decision because I was absolutely blind of what happened. But now that I have data and a lot of records, mm-hmm. probably the role of the patient is going to change to be more active.
You know, a lot of times patients want a second opinion, and that can be difficult to do. They may not live nearby a center that's really known, for example, with their disease, and it may be difficult for them to travel there. So through technology, we do have some programs that allow for second opinions, allow the patient to transfer their information, whether it's CAT scan images, radiological images, and their previous workup, so that another one of our physicians are able to reevaluate them and see if it would be worth their time and effort to be able to come all the way into the hospital.
Okay. Do you see a change? You mentioned that before we started the interview, the generation change of how probably this new generation is being more healthy, no smoking, no drinking, but the old generation, the older now, has problems that you need to deal with right now, and how technology is helping both of these generations.
Well, I think one of the things that I think is going to continue to make healthcare more accessible, but also easier for the patients to understand and make use of, is, as Dr. Ivascu was saying, the information technology systems that are growing and being put into place. So, for instance, at New York Presbyterian at Weill Cornell, we have a portal for the patients and their families, Weill Cornell Connect. They can log on to the system at any time and have complete access to their records. And everything from blood work to a consultation note to images to reports, it can be disseminated to any one of their healthcare providers. And even within our own healthcare system, it's easy for everybody to see. So there's not a lot of duplication. It will eliminate the duplication of work. You've already had problem X worked out. There's no need to spend time. Now you have a new problem Y. Well, if you go to see a new person, a new doctor, they're going to want to know everything about problem X and may spend an inordinate amount of time going over something that is a problem you really don't want to spend time on. This will make the process more efficient, it'll make it more cost effective, and it'll make it more accurate, so that whenever you're a young person, you're advocating for yourself, but a lot of times the younger patients are also advocating for their older family members and older friends. Right, the older generation may not be so savvy with electronic medical record, with technology. They understand it, they know it's out there, but truth is they're afraid of it. Whereas the younger generation just boom, 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 they just dive right in, because as she says all the time, you're just one delete button away from just making it all go away and starting over. Nobody cares. They're not nervous about it. So I think building these integrated healthcare systems, building the integrated electronic medical record. New York Presbyterian is investing substantially, not only in telemedicine, but in electronic medical record. And it's really about the patients. It's really about, this is their information. We want that information to be owned by them, understand that it's there for them, and it's really there to help us take care of them, but they own it.
I was going to make the same mention, that we're in a really exciting time at New York Presbyterian because we are engaging in a tremendous overhaul of our electronic medical record. We have I think 9 campuses now throughout the entire region, and it spans a tremendous geographical area, and it spans a tremendous area of specialists throughout that whole region. And this helps increase accessibility to patients, and it really ties us together as an enterprise, because in the course of the next 2 years, we'll convert over so that all the hospitals are on the exact same electronic medical record. And this will provide a certain level of interchangeability and exchange of information throughout the enterprise that we've never been able to achieve before, because of course over the years we joined many hospitals together over a decade of time. So it took maybe, I think there were over 40 different electronic medical systems that are being all pulled together, and we'll have one overarching system. So it's actually been a really exciting process for us.
And what is going to happen in the future with that data is going to be amazing.
Very powerful.
For investigations and research, I think it's going to
Exactly.
Absolutely. And for monitoring patients, so that if they have reminders in their electronic care and they're entering the system at any different port, it will help remember that you're overdue for this health maintenance. And so if they are coming in with an eye problem, they have a health maintenance issue that's outstanding, it will be popping up and helping to bring attention to that. So anytime they're getting care, I think it will enhance their experience.
Okay, wow.
Yeah.
And a good example of how we're using that technology, or how we're trying to figure out how to use technology to our advantage and to the patient's advantages, would be, with what we do, heart procedures, heart surgery, anemia and bleeding is always a concern, and patients, if they can avoid transfusions, it would be great, because there's always risks of transfusions. As life-saving as they may be, if you don't need one, it would be great. And the idea of being able to prepare a patient who may not live within Manhattan or within the 5 boroughs of New York, but may live 100 miles away, if we can get them into the system and then make use of the satellite hospitals, the regional hospitals that go from north of the city 60, 70 miles to dense urban populations in our community, Brooklyn and Queens, you can then make it much more convenient for the patient too. And if it's easier for the patient, they're more likely to do it, right? If it's very difficult and challenging, especially say here in Mexico City where you have a dense population, getting around is not so easy. But if you had a system where, and I forgive my geographical ignorance, I have no idea what your communities are like, but if you had a hospital that was tied into your main hospital here, your most respected hospital, and that access, that access for the patients made it easier for them to get the exact same level of care in that hospital, rather than fighting the traffic and the expense and the time of coming to the city. Again, if it is easier for them to get to, they're more likely to do it. So we're making use of a big healthcare system like New York Presbyterian and others, and try to say, okay, here's how we can standardize care across a healthcare enterprise, so that the patient showing up, in our case in Croton, which is 70 miles north of New York, gets the exact same care as they get at Weill Cornell. That's sort of what you want to have.
Yeah, as you mentioned before, probably it's more about time than when you ask your name, your blood type, everything, that you can make a decision probably more, not instantly, but you will have this whole register that probably is going to save your life.
Mm-hmm.
Okay. And to finish this interview, how do you see the evolution of heart diseases? I mean, in terms of probably in older generations, we had more physical work probably, and now we're spending so much time on the computer, and I was reading about how our bodies will change, because we are no longer using probably our fingers, our fingers for example, or we are not moving enough. So that is absolutely changing our chemistry and how our body is functioning. So how do you think that these heart diseases are going to evolve in the future according to our lifestyle?
Well, go ahead.
Just say, we're fortunate that so much medication improvement, technology, whether it's being able to do surgery safer, things like that, has improved things. But you're exactly right. We need to make sure we don't lose focus of the things that we can do ourselves to keep our bodies healthy. So incorporating good nutrition, exercise. Those things are still really essential, and in some ways, because we have, you still have some genetic risks of things, and so even if you eat a really good diet and you don't have great genetic profile, you may still have high cholesterol. So being able to use medications to address those patients. On the other hand, we can't let those sort of things become a crutch, so that we don't take ownership over also being proactive with nutrition. I think you're exactly right. We need to keep putting that into the social consciousness, that it's important to bring into our modern lifestyle some of those other good habits.
It is a concern in that, as you alluded to, the sort of inactivity that then trends into obesity epidemic in the United States. Our children are not as active. The adolescents, the youth, they're not as even though they're more technologically savvy and they may understand it, they're definitely more sedentary. And you're right, you're using your fingers more than your legs. And at some level, we have to find a fine balance between allowing technology to do everything for us, and yet not getting enough exercise to stay healthy. And we know that it's going to take a little extra effort because it's easy to sit down and have everything in front of you, whereas you want to be able to stay engaged in your own activities, get out there every day, make sure you're doing things on a regular basis to take care of yourself, avoid diabetes, avoid obesity. Obviously, we want the people to not smoke, things along those lines.
What about vaping?
Vaping? Oh, geez.
Well, that's okay.
Well, no. I think it's for addicted people. It might be a way to move away from the addiction of nicotine and cigarette smoking, and for that population, I got
transition.
it. Children and young people
that's exactly
are
the problem.
addicted
So
to
one
vaping.
of your very active social media surgeons actually has done a great job of putting a lot into Twitter about vaping and the dangers of vaping. And it is a real problem, especially in the youth, because it doesn't have the same stigma as smoking. And that's the thing we have to we really push back on. Absolutely. And it's targeted. They're fruit flavored, they're very attractive, packaging that is attractive to children.
Cool.
Exactly, it is cool, and it's been made cool. So this is sort of a repeat of a past generational problem of smoking being cool and fighting back against that. But we really don't know the long-term risks of vaping. But inhaling any foreign substance into your lungs is not advisable, and probably will have some significant downstream problems. So I think that's where we have to, exactly as we started talking about, putting that out into the social media, putting the risks out there. If your doctor won't tell you it's bad, then you definitely won't consider it to be a real risk. So it's our duty to make that really clear.
It's interesting if you look back, at least in the United States, into the 1950s and 60s, when the Surgeon General, who used to be this overpowering individual, was like some sort of overlord. Whatever he spoke, that was the way it went. And when they finally did come out and say that there was a significant risk of cancer in cigarette smoking, it's amazing when this is the population, the baby boomers that I talk to and take care of now. They will tell you that they quit smoking as soon as they heard that. Once they heard the Surgeon General, some authority figure, tell them this is really bad, a lot of them stopped. Now, not everybody stopped, but a lot of them did. We have to figure out how to use current technologies, like I was saying, not so much the patients and the potentially partially informed taking control and being influencers. Have the physicians be the influencers. Have them saying to the youth, listen, this is really bad for you guys. It ain't cool, all right? It's not cool. And you got to figure out a way to get that message to the youth, because that's how they communicate. If we don't take advantage of that, we're losing an opportunity. Because we can have an influence, but we got to say, yes, tweeting, and I have to learn from this myself, tweeting is okay. You got to figure out a way to get a message to the youth. Podcasts, whatever it means, you got to figure it out.
I think that's
and I don't try to make to defend vaping, but we are living in a very polluted cities. So most of them say, if I'm already breathing this, so it's the same that I smoke or that I vape.
But one thing is concentrated, it's not regulated, so you don't know for sure what you're inhaling, and there could be contaminants, there could be there's certain particulate things that are breathed into the lungs can cause a lot more damage, long-term damage, and even permanent damage. So you may not be able to avoid pollution, but you can avoid bringing extra pollution into your lungs.
Okay. Well, is there any message you want to say to the Mexicans, like a very specific message?
Well, we're very proud to be here, and we're really excited to be part of the conference this week. It's an exciting time, beautiful country, and we've already really enjoyed ourselves being here.
No, the Cardio Academic Conference is fantastic. It does bring a lot of attention to Mexico City and the country of Mexico. It shows others in the United States and other parts of the world how advanced care is here in Mexico, and how between the government and the physicians, they're doing everything possible to make life better and healthier for the population of this beautiful country. It just takes time and engagement, and the patients have to be engaged themselves, but there's a wonderful opportunity to just make the population in general healthier and happier and live longer.
Okay, thank you so much.
You're welcome. Thank you.